Good morning, and welcome to our inaugural Dissemination and Implementation Symposium of the Clinical and Translational Science Collaborative of Northern Ohio. We are thrilled that you're here. For a little bit of background, our CTSC of Northern Ohio is based here at Case Western Reserve University and includes our partner institutions, including Cleveland Clinic, University Hospitals Cleveland Medical Center, Metro Health Medical Center, the Veterans Affairs Medical Center, the University of Toledo, and Northeast Ohio Medical University. I'm going to start by introducing myself and my colleagues who you will see throughout the morning and who are part of our planning committee for this half-day symposium. I'm Anita Mr. Hebert. I'm an internist at Cleveland Clinic and also our center director for the Healthcare Delivery and Implementation Science Center at Cleveland Clinic. In addition, I serve as the Cleveland Clinic site lead and dissemination and implementation lead for the CTSC. My colleague, Dr. Stephen Maciano, who you will see later, is our quantitative methodologist in our Healthcare Delivery and Implementation Science Center at Cleveland Clinic and also part of the Dissemination Implementation Core for the CTSC. Dr. Peter Hovmand is a professor of medicine at the Center for Community Health Integration at Case Western Reserve University, also one of our leaders for our RC2, which is part of our CTSC, and you'll hear a lot more from him later. Dr. Mary Delansky is the director for the Sarah Cole Hirsch Institute in the Francis Payne Bolton School of Nursing and professor of nursing in the School of Medicine at Case Western Reserve University, and is the co-chair for the Workforce Development module for the CTSC. And Dr. Valerie Chepp is our qualitative methodologist in our Healthcare Delivery and Implementation Science Center at Cleveland Clinic and part of our Dissemination and Implementation Core for the CTSC. So you'll be seeing all of us throughout the morning moderating a lot of these discussions that we have planned for you. So just to review our learning objectives, we would want to improve understanding of dissemination and implementation science principles throughout this morning. We would like to demonstrate the dissemination implementation application to practice and research, including operational and community alignment specifically. And we would like to discuss equity in implementation, including cost measurement. And here is our agenda, just an overview, and we will be introducing our speakers closer to the time that they are presenting. But we have wonderful keynote presentations planned with Dr. Jonathan Tobin and Dr. Todd Wagner. We also have two panel discussions, the first on implementation science and operational alignment, and the second focused on implementing for equity. We will end with some reflective comments, and we plan to stay on time and end at noon. Just some logistics here. The symposium will be recorded, and it will be made available on the CTSC YouTube channel, and a link to the recording will be sent to you within 2 weeks. Here are some instructions on claiming CME. Now, this was also sent to you by email yesterday for having registered for the symposium, so you don't have to take notes on this right now. You'll also have a copy of the slides later on. But it's important to note that you'll have 7 days to claim credit via the mobile app and 30 days via desktop. Regarding the other logistics for the questions for the morning, please submit your questions using the Q&A function, and a moderator will read your question to the speaker or panel, time permitting. And please use the chat for comments only. Next, I would like to introduce the principal investigator for our CTSC, Dr. Grace McComsey. Grace is the Vice Dean for Clinical and Translational Research and Director of the Clinical and Translation Science Institute, and again, the PI for our CTSC of Northern Ohio. She is also the Gertrude Chandler Tucker Professor of Pediatrics and Medicine at Case Western Reserve University. Welcome, Grace.
Hi everyone. I want to welcome everyone. Thank you for spending Friday afternoon with us. As most of you know, CTSAs are funded by the National Center for Advancing Translational Science. It's a mouthful, NCATS. NCAT's mission is to turn research observations into health solutions through translational science. So as you see on the slide, the 5 goals center around increasing the pace of treatment, enabling more people to benefit from research, and identifying and addressing research inefficiencies. So obviously, dissemination and implementation are key areas of focus of NCAT and our CTSC of Northern Ohio. So I want to welcome you. I want to thank Dr. Misra Hebert, who you just met. She's the lead of DNI in our CTSC. I want to thank her and her team for putting together this wonderful program. I hope you learn a lot and enjoy, and thank you, Anita, again, and the team for putting this program together. So I'll pass it back to you.
Thank you so much, Grace. I just really am excited to be in a position to help promote dissemination and implementation within our CTSC. And my team is very excited to be here this morning with you. And we have such a wonderful morning planned. I just want to talk to you a little bit about just the overall focus of implementation science. Broadly, we are really just trying to translate research evidence into routine care delivery. And to do this, we really have to understand context, which is kind of the buzzword in implementation science, trying to rigorously collect data to capture context of our care delivery settings, whether they're within a health system or within a community. And context can be measured at multiple levels, including at the community level, a health system level, the practice site level, provider level, patient level. And we know that all of these different variables at the different levels can affect how we implement research evidence into practice and often lead to adaptations and tailored implementation strategies. So we know, again, that adaptations will then affect outcomes as well. So it is really important for us to rigorously understand that translation process so that we can create appropriate strategies to achieve equitable reach of our interventions as well as equitable outcomes. And so I think that the morning will really be spent talking about these important issues, thinking about talking with operational leaders and others who focus their research on improving equitable translation of evidence as to how these implementation science principles can align with their own work. And I think a lot of what we will hear about this morning is that people are implementing in different ways and maybe aren't thinking of themselves as officially implementation scientists, but are contributing to this knowledge translation and improving outcomes for our patients and community members. I do want to call out specifically the importance of alignment of implementation science research with operational leadership and improving the quality of healthcare delivery with this important alignment. I think that this has really been recognized specifically by our CTSC institutions, and I would say that's a strength of our local institutions and this ability to promote this type of alignment to improve care. And so some of our discussion will really center around that this morning. For example, 2 of our CTSC institutions are participating in an important another important initiative beyond NCAT's, the Patient-Centered Outcomes Research Institute Health Systems Implementation Initiative. Cleveland Clinic participates that, and I'm co-leading that for Cleveland Clinic, and University Hospitals is also participating. So I think that we do have this kind of in our blood in our CTSC, and so have this opportunity to really build that locally through our institutions that can extend to improving the health of our communities.